Our bodies go through a lot from pregnancy, conception, day 1 through our 40 weeks where we finally give birth to our baby. During labor, the same way our bodies go through a lot, whether you give birth naturally or through C-section. Healing is a process. Nobody expects you to make a fast recovery right after giving birth. Today on About Time, we are going to talk about the healing processes we go through postpartum. I'm Nana, your host as always, and as I keep reminding you, if you haven't subscribed, please hit the subscribe bell. The notification bell is also right there. Please hit on that as well so you don't miss out on any of our other exciting episodes. Follow us on all our social media handles on Facebook, TikTok, Instagram, and Twitter. The name is Citistar TV. Please do so, and we'll be right back. Welcome back. I believe you have subscribed now and you followed us on all our social media handles at Citistar TV. Today on our episode, we are going to talk about postpartum healing, the journey, the process, what our bodies go through in order to heal and go back to how it was before we went into our pregnancy journey. So I have with me here our beautiful midwife from New Tafel Government Hospital, Madam Mavis Amwakun, to discuss with us what our bodies go through during these healing stages. Madam Mavis, you're welcome once again to About Time.
Thank you.
So after we've had our babies, our bodies go through a lot. Ebedu ho nafe de yafa awoni mu ama yabre hona nankasa watene nkase wabre. What happens at this stage?
Well, okay. At this stage, we call it period. 6 weeks.
Okay.
Into a period that the body reproductive organs return back to its non-pregnant state.
Okay.
Into 6 weeks we and uterus would the air kesiye or would the no air kesiye or channel so be kesiye kakra. Ningina no 6 weeks e be yan kakra sa na ayeden na call back to the non-pregnant state. Enti no saa emrewe no obaby awo a ye ma waduro a wo be de wo be no ye de ma because ye call say ye by surgical means kra na instrument na ye den ye use ye enti no e was say ye ma waduro so that be ya e den a yakọ or sterile sa inside no how sterile. Who knows? Say be an instrument, it came into contact with something. You might not know. To once a honey sterile inside na sterile na bibi alcohol there was a man would draw so that be ya unya infections biano. The sign John so boa ma day. Oh he kama. And after so personal hygiene so yeah then accounting. Personal hygiene very play an important role ewo awo. So one maintaining the year and also no e ma wo healing no enye den en contem. And after so no say wasete ye na pam wase a ye ma waduro sa obenom ya advice so say nkotena nso hie so because ahoma ne no akasa na ne ho. Say for by a pama and no idea, and none of whom say, Mamines and doctor may ye my home and that day. And no one and whom we advise to some cotton so share swing a day. A banana and an answer so a hope a gapy. A gaping so a infection I take place. Internal delay healing process. So, oh, yeah. I feel so no. Or baby, I now yes, you advise say ube symptom because the more water hobo unke count who active no and also so no esa moja no current mean there full sane kama interno delay healing process no. Okay. Until we advise to ambulate who ambulate ya aid in healing process. Ambulation is also be seen 190.
Okay.
Most of the time will be yes, a doctor be review na or say start ambulation. Start ambulation just a man in 90. So what I said there were 10 baby or no.
You're trying now, no.
Intino man in senior day and 90. But who said To bo ha or office or intimia medam pem a post up day one. Yeah, operation run at the chain and I day one. Ain't no. Doctor says see form. Ose me ya. Office all you be better 1 hour ho. So what can count when they active. Yes, I boa like healing process no point e so ntɛntɛm ba wo da fa akwatem bia no ohun so baby be yo ya obi home on feel so ma complain bebrebe a ma hire me ya ma hire money say what go through that process 9 months no things have changed in the system hormones na yeding as a scientific na ni never the ever back returning back to it non-pregnant state no into your process. Into so you have to help yourself. The trim why necessary changes ning 19 year the ain't take place. But so when you with you now you trim there, made them me ya. It will take time now was saying cap. Who say sweet name, you won't now why no phone san won't tell that. The boy send made them ya me who told that. No, you are part of the healing process. You play an active role. It is a one share, one born who so. Now, castle me the timudenti. You are wasting your own time. Ebi a oye government work and also still she be not more 3 months away a maternity leave no. What the best na still recover. So half an hour be excuses baby saying I made them a home tom. But if think how you did the right thing.
By now,
you are good to go. On I want na mo baby no. When you are the horse one or by what you feel fine. The healing process we individuals we play active role in it, and yet it's not about a draw. Our someone so play a part. Na baby anything and cost so fine man.
So now your midwife ne kind or see we play an active role in our healing process. And yet they one thing. Obi expected so be do hospital na. Ufi hospital be do if na ma hon told baby. It happens. It's something that happens gradually. You need to play your part. Don't be too enjoying of your state. And God say, oh, enjoy the stage you're in ma fro. It's so and you obi no nya aboa for. So please, to help your own self, to make sure that you heal and you heal properly, you need to practice personal hygiene. She mentioned that. It's very, very important. Mary Lady say, once you come back from labor, you still be flowing, which means you need to be constantly changing yourself. Because even normally, you know, blood, it has a smell. So imagine this. You have a pad down there, these tampon down there, okay, and you're bleeding and you're peeing and you're not taking care of yourself, you're just going to end up smelling bad. And you have to make sure certain activities you do, if you are bathing, for instance, that's why you CSR, you make sure say the incision is covered so you don't the water doesn't get into it. And even tampon, no, I think except for a few weeks you're not supposed to bath.
Incisional site it should be dry and clean. No. So why a sectional until say the wound is totally covered. Wound site. If say you're open now, we don't advise you to take your bath. Until say a wound no be covered like a swakata.
Yes,
you'll be cleaning yourself and not paying you all the towel be bones now power throughout. Open say wound no size ne bedding ebe close. A close area, then you go on with your bath.
And like she also said, you need to be up and about. It helps to get the wound healing. She used the word I don't know that word, but just like she said, it basically means be active.
Ambulation.
What is it again? Ambulation. Well, that's the word. I have a word for today. Ambulation. You need to be up and about to help your wound heal, to start the healing process. Please don't be lazy. Please don't be reluctant to exercise. Not running, no please. Just get up. Take a stroll within your room. Just walk from one end of your room to the other end. Maybe do this 3 or 4 times and then lie down. That is understandable. But don't lie down and expect things to be done for you. That is not how healing works. It's a process. You need to play your part. So let's come to the parts. Okay, so before you even come to nutrition, like I was saying, you need to make sure that water doesn't even get to your insertion area. Like she said, you need to stay clean and dry. The key word being dry, so the wound can heal properly. So it will get infected. You may think you're trying to stay clean and you can't wait the 1 or 2 weeks to not bath for the wound to heal. So you're going to bath. Madam, you're going to end up with a very infected wound that is going to make you even messier than you would have been without bathing. So it's best that for that few, about 14 days, that your wound is going to heal, you need to listen to them and just use towel. Dip some towel into water with an antiseptic, with something to make sure that you're feeling clean enough, and then wipe your body clean. Do this. You can do it twice a day, morning and evening. You don't need to bath. You don't. If you've had C-section, you know that for the first few days, you don't need to bath because you need to make sure that that wound stays dry. Also, with C-section, you need to be up and about, but you also have to make sure the things you are doing are not extreme, because you end up doing more harm than good. The fact that you are supposed to be up and about doesn't mean go and raise 1 gallon of water and then take it to that you want to sweep your room, so you're lifting your heavy couch. No, you're going to put more pressure on the incision, and you realize you might even start bleeding again. You need to take care of yourself. Your body, it's your own, and it's going through a lot, and it's healing. You need to give your body time. You don't need to rush it. Let's get to nutrition and what we eat during these stages to help us heal properly. So I will go with vegetables and fruits. What kind will you recommend, and what nutrients are healing that will prompt healing?
Okay, I say, most of the time they do more constipation. So I'll advise you take in more oranges.
Okay.
Pear. And also digestion. And like you can eat like fruits, but make sure say whenever you eat, like they know what did I was say only fruits be. Only eduaba, idanka, banana cry is okay. Pineapple bit me like bit me the fruits ni be. After say wow, so no so boa, Emma like healing process. Way simple. And I think so like other foods, say vegetables like so what I say, baby, because at that time you need it. You need them for your healing. I think so ben no more quite. Also after section no cry, no fit you now would heavy food. Meat near day, take some time and granuts and you need you why you don't eat instantly after section. It takes some days. Since I like processing in a eye over like lice should be okay. So cocoa, liquid foods no.
Yeah, and a personal experience, you're not supposed to take milk.
Okay.
Yes, during after C-section, right after C-section, I think milky foods and you are supposed to limit your milk intake. So we are still talking to you about the nutrition that can help you, what to eat and what not to eat. You need to watch what you take into your body, because your body is healing. If you're taking something that's going to hurt your body, don't be taking alcohol. Don't be taking alcohol. You're bleeding and you're taking a lot of alcohol. And please note, at this stage, too, you're also breastfeeding. So whatever you go into your body goes into your baby's body as well. So you need to be very cautious. You need to take things that are healthy. You need to make sure that the things you're putting into your body is healthy. And your vegetables need fruit. You have washed them and casta it with salt and in warm water as much as you can. Make sure that there are no bacteria. You're not causing harm to your body. We are still talking about healing process postpartum. Please stay tuned and we'll be right back. So we are still discussing our healing journey, our healing process. Like I said, it doesn't take a day. You need to go through a lot. It's a journey. It happens in stages, from one stage to the other. Don't put too much pressure on yourself. Now we're going to talk about things you need to avoid during this time. Please, especially if you've had a C-section. Yes, most times our bodies, on our legs, on our arms, we can get a cut, a wound, and then people treat it by putting stuff, a cream and other things. And please, the way your skin heals during a normal cut or a scrape, it's not the same way your abdomen heals when it's been through surgery.
Oh, that surgery, no surgical intervention.
Mm-hmm.
And then the only surgery like 6 way na ye cut into.
Mm-hmm.
Into like
one skin.
No.
Just like she said, they've actually cut into six lining of your skin.
Lining.
Yes. What you chop one line, second line, third, fourth, fifth, sixth. So it's not like blade be a chow keke. Now we can say, oh, made injection violence. Yes, and I'm made Vaseline.
Have to heal.
It won't all heal at once.
Oh.
One layer will heal, the second layer will heal, the third. 6 layers now go through for you to have had that C-section. Don't treat it like any common wound. It is not any common wound. You need to give it time. And kofa towel and tun so shiem and kasa what they to uyefune so say embo muma ekroni. No. That wound needs to stay clean and dry. So you need to make sure you're not introducing moisture into that incision, because the only thing you're going to do at the end of the day is infect it. And then when you infect it, that dry, it will be very, very bad. It will start to ooze. I know what I'm talking about. It will ooze. And the
wound too will get.
Yes. And even your skin, the skin around the incision, you see that it's getting sore because the infection will start eating into your skin, and it will eat into all the layers because you didn't give it any of the layers time to heal, and that is going to end up in a very bad, probably fatal situation. You need to give your body time. You shouldn't be lifting heavy objects. You just came out of surgery. C-section and agro and your surgery. I know now when they put us, and they don't even put you under anymore. They let you lie down and then they do the whole procedure whilst you're still awake. The fact that you can experience it doesn't mean that it's not surgery. You're going through surgery. Your body just went through something traumatic. Give it time. You feel like you're a superwoman. We get it. But please, at that moment, don't show off your superpowers. Don't go carrying heavy objects and be lifting things about the house. No. You need to exercise, but don't go jogging.
Swimming.
Because if you go swimming, you're going to get moisture into your wound. You catch yourself, don't bath. You're going swimming. No. It's a no. Don't do skipping. You'll be jumping up and putting more pressure on your abdomen. That is not advisable. Squatting, you can't. See, anything that puts too much pressure to the extent that it can open the wound, it can open the incision, you need to stay away from. At this stage, postpartum belt, no. Your wound is not open. Oh, but be squeezy.
After the 6 weeks and like all these organs have returned back to its non-pregnant, you can start it.
You need to give the wound time to heal.
Yes, but some people, because of body shape, I can't wait. No, you have to wait. Yes, have that patience and wait until like you are healed before you start putting those belts.
Because and even with some of these belts, they are latex,
Yes.
which means a ball will stand and some skins once latex, but you can't no sweat it, no react it. Good. No, I'm not. But also, if you are very familiar with some latest products, waist trainers out there, you realize that when you take them, you'd have realized that you'd sweat once you had it on, and your skin has reacted to it. Sometimes your skin becomes really soft, and sometimes there are rashes on your skin. Now imagine this. You put all that thing, it can even, the sweat can seep into your wound. And that is going to be very bad. It's going to infect it. Because once I start to say woozy pe, must smell about when, and mind you, you are not bathing, you're just cleaning yourself up. You need to stay, don't put too much pressure on yourself. Your body just went through a lot. Take your time. It's one day at a time. Maximum of 30 days, your wound would have been healed. And then you can go about your life. You take good care of yourself. Within 30 days, wound ni betimi healing. Now after the what started, you need to limit it. You're starting giddy. You don't rush into it. You don't start putting too much on yourself all at once. And when it comes to natural too, the natural birth too.
Yeah, that one no na make her say na so share so. Only if say unya perineal tear na say ye ma episiotomy. Episiotomy ye say bia wo no obi o ho a wo da. Most of time no your money ye episiotomy. Episiotomy no wo da. Chim ontimi nchim. So at your chim cry baby head no be so ntintim ye emba. Tina ya kate
or vaginal way.
Kakra. Nti ye no once ya kate no ye be ye de be siucha. Nti ye siuchi no. And then the advice or say, and I so bo cry nye episiotomy na naturally no ate. When you take a clinic you have to siucha it. And yes na se baby. E bien so sad na eno no di how na be ma wo madam because okunu on obefa wechi. Wase ye kese pe because sa ya na eso. You may feel so am pam kwa enye but enye easy. Some come mobile with that experience na ultimately it's very very bad. Into ye be sa siuchi no unya sa ate na perineal tear na be siuchi na na episiotomy tear na be ya ma teno na ye ma wa ya advice o say nkotna nsuo hie so because you can say ahoma na ye de pamoye enane no ho eno enane no ho ntehu hia but okotna because say mre the moment when it get come in contact with hot tena ebe nane no to that time no bia na okro no nyede enwu na nane ade no so ye de pam say things will come in a position. What I say bia vaginal walls no will come in a position. Now call back to maybe why I say virgin no. But so no kwotna nsu share so ama ade no yeah say embra into a position now wo de wo momo akobiye no. At that time no so like enya bie pe infection be de ebeba infection so ba wo pama honam sa vaginal wo bo na etete until you yourself can also you suffer. So at ya say obebre until no avoid all these things and kotna in social so bo as me ma me sin me maintain in social na hit ni mbo mase and am say pam mase no di ade nko a the person enya wo no nkro na ebewu yama wadru yama antibiotics be boama nkro na eden healing. Until there is no need for any warm way compression bia so what I say what dia wo hia ne say no mundro na hohoro wase fine so what I say because say moja ba until you was wase dey was and even the washing of no vagina and perineum it should be what anterior posterior. It shouldn't be posterior anterior. Make anterior posterior early on make sure say anterior front and posterior back. The anus is the posterior part of the perineum and the vagina is the anterior part. And the anterior posterior no from vagina or a vagina no to
What?
rectum.
Yeah.
Because the normal flora at the rectum is very, very high and it's bad. And you don't do it like from the rectum to the vagina. What passes through the rectum is not the same as what passes through the vagina. So we do it like from vagina to the rectum. No. Vagina no me who bibia anything harmful efa honoma ekofa rectum na ebe cause problem. Until all the time you should be anterior posterior. Oh wase no from wotwe now they call utrum. Until that time now you do it that way. So that the healing process. And after that cry no as a woman you wash from vagina to the rectum.
Okay. It's a good so can what not to do. Now may Trail say we're about to talk to you the things that if you see on your body during this stage, run to your doctor. For instance, you've had a CS and then the incision is supposed to be clean and dry. We've been saying this for a while, but then you realize that your wound is oozing. A chrono is starting a fins you. As in, you know they are going to treat it and then they're going to put a covering lining over it to cover it. But then you realize that the lining is soaked. Ama, it's supposed to stick to your skin, but you know, it's stained. Sometimes you can even smell it's smelling bad because there's some fluid coming out of the incision. If you see this, please don't think you can treat it. Just go straight to your doctor. Go straight to see a nurse. Go straight to the hospital and go and show it to them and let them help you. And it's nothing as oh, no. That is a very bad sign as a CS. You need to take it to the hospital immediately. When you start to realize that the incision wound, you know, one case out that you start to realize that it's starting to hurt more than it as usual, and it's spreading. It was an incision line, but now a chronic didim emma air froa. You need to go and show it to your doctor. And mind you, are supposed to be going to the hospital for these treatments. You're supposed to be going to the treatment room for them to be treating almost every other day. That means if you go Monday, you go Wednesday, you go Friday, you go Sunday.
Dressing.
Yes.
Like we dress it alternatively.
Yes.
So you come on Monday to dress the wound. Tuesday you not come.
Wednesday you come. Then Friday and Sunday. Every other day. Please don't say oh, my come Monday. It's me change Friday and then my break. No.
And even sometimes we like when you come and the wound is already covered, like there is no opening into it. We sometimes advise to like if some of them staying far
away.
We advise them to like the most important is you wash your hands very well. Use spirit and cotton to rub it. You are good to go.
Good. But the thing is, until such that the wound is closed,
yes,
you need a doctor or a medical professional's assistance. Don't take it up on yourself. If you see this, even after they've seen the wound is closed and they're telling you can do it on yourself. If you see any of these things, you feel pains, you realize a chronic didim, things you, and that's why you say abdomen honum na chronically. So the sense of be walk grandpa. You can't stand up straight. You have to walk and you are bending down because when you stand, you try to lift yourself up. There's this pressure and pain that comes from your abdomen. Just go straight to the hospital. Don't go to a pharmacy for painkiller. Don't go to a pharmacy for your own treatment. No, just go straight to the hospital. The bleeding is supposed to happen for a number of days. It's been past 90 days and you're still bleeding. Is that normal?
No, like we group them into two. We have primary PPH. PPH means postpartum hemorrhage. Post means after. So within the 24 hours, we call it primary hemorrhage. So after 24 hours to think say 30 days, and you are still bleeding, we classified it as secondary.
Okay.
And that one is not a good sign because ideally, though you bleed, but it shouldn't be heavy.
Okay.
We have slightly moderate and heavy. So after the 24 hours no, we assume say the bleeding coming out no should be what, either moderate or slightly. But in your case it's different. The bleeding is still hot, heavy. And sometimes it comes with clots. So when you see these things, you don't sit home that, oh, or baby, I see the
Different.
no, your case is different. You are bleeding like a day. You can change pad 3 or 4 times, more than 6 a day. You see the whole thing. But the normal one, you can change it morning, afternoon, evening. But this case is different. It's more than 6.
You're running through 6 pads a day.
And it's heavy too. The bleeding is heavy.
Hence, like, you running through 6 pads a day. Yes.
So you don't sit home that it will stop. There may be what, a cause. So you rush to the hospital and report to your midwife. And definitely the doctor will come and review you and see what is wrong with you. So when you see that you are bleeding, that one after 24 hours, and even when you are still at the hospital, that's what I'm saying is what postpartum hemorrhage. Because like the bleeding is different. Like it come out, it gashes out. Boom. So that one, like,
it's only supposed to happen in the hospital.
It's an emergency. No, it's not even.
No, like right after birth.
Yes, but when you after 24 hours and still we are seeing
seeing gushing blood, you need to rush to the hospital.
So that one too, when you see it, like, you have to do something about it. Don't sit home, because when you bleed, like, you can die. Because a lot of women die through this
of blood loss.
Yes, PPH, postpartum hemorrhage, a very, very serious.
So like Madam Midwife have said, if you're experiencing heavy bleeding after 24 hours after birth, you don't keep your mouth shut. You don't overlook it. You just go and report it, because it can be so bad it can kill you. You can die from blood loss. So please, stay focused, stay woke, pay attention to details, pay attention to these things. They are very, very important. We are still talking about our healing process after labor, our postpartum healing process. Please stay tuned. We'll be right back. So this is still about Tanya on City Star TV. We are still talking about our healing process. We've been through a lot of the stages, what to avoid, and the signs that you should look out for. That when you see, just say, hey, I'm going to the hospital. Now we are finally gone through everything, and we are at last stage. The signs that shows that you are completely healed. Now, if with C-section mostly, you realize that the wound, the incision, it has closed up, it has fused perfectly. In fact, they stop putting the spirits and all these things on it. They can tell you, that's when they tell you you can start bathing, because now even if water gets there, there's no hole, no incision, nothing. There's no openness there for the water to seep through and give you any kind of complication or infection. So when that happens, it means you're safe. When the wound is sealed, completely healed, we know how a completely healed wound is like. No opening of any sort, no soreness. You can still feel pain, but not extreme pain that you'll be needing extreme painkillers and all that. So when you realize that, it means you're out of the danger zone. It still doesn't mean that go about carrying heavy objects. Your doctor will advise you that even for a number of years, even sometimes it goes on a number of months, they can still tell you to limit the heaviness, the heavy lifting. You still need to be very careful, because your body has still gone through a lot. And with a natural birth, some of the signs of healing will be,
the blood will stop flowing.
The blood will stop flowing.
And also, like, you feel okay within the body.
Okay.
Say, oh, say I'm fine. Okay. I'm like, oh yes. And on say those times you are prone to infection. So when you are free from all this infection, urinary tract infection, UTI, like wow chemo because on some moja ne basana your bladder no they are all close. But you are free from all this. Or no phone sober fine. You mother, you are healthy when you're like breast engorgement be like you are
Your
free.
body, you realize that your body has healed. So basically, when your body heals, you can feel it. There is no pain, there is no stress, there is no risk to infections. And then you can do whatever you want to do, but limitations. You still take caution. So you just give your body time to heal. Healing is a process. Do not rush it. Do you have any advice for our viewers today, madam?
Yeah, like our advice publicness after 6 weeks no, it doesn't end there. Yes, because they're 18 months, almost 2 years answer.
Now everything will be completely safe.
So we are okay. And no. And most of the time mothers no, they deprive their husband from sex.
At what stage can you even give it? 6 weeks.
Yes, after 6 weeks, we are good to go.
Okay.
Yes.
What about CS?
CS class 6 weeks. Okay. That's when then you kind of period.
Okay.
Everything return back.
Okay.
But something vigorous.
Okay.
But you can do it. But almost deprive you from doing it. But we advise almost husbands and say, "Obo ha no healing ne ho nto no."
But no o think kasa.
Nkan ideally no. Ebi after me fan say be 8 weeks or 9 weeks. Ndo betimi aye de opesa wonya bia. But say obesa wo biem ne de bi obi, for instance, somebody went through section. Now within sayana now the person is pregnant again. Don't expect say you go through normal pregnancy. Vaginal delivery. Because will you trust no? Like a healing completely. Though so returning back to way no.
A healing completely. Because
see,
you went through section.
It will rapture.
Okay.
So what I say. But after 2 years, you are good to go. Bet me assign anyam. But a bit more harm, more promo was me the person me one terms also. So one person now is different from OBI section. 1 hour and so banning 8 months can person on the chair. You are good to go. But why you see yes na ya cutting ya chicha ya chicha on honam. So I would there no and pressure. Because already know why is there pressure on it. One man is a grace period no. Man one ton. And now on 7 baby no more that would in stretch it, say stretch it. But meanwhile no. We are be a pempam who say be man stretching e be the same any friend rapture no. So what I say enti man no sa grace period 2 years no no healing no ne ho nto ne kama njeja ne ho though say period 6 after 6 weeks the reproductive organ have returned back to it not pregnancy.
It's not
but
specific to
for CS no na 2 years no to avoid all these things no na 2 years na.
So our midwife has spoken. For the natural birth after 8 months, you can get into having another baby if you want to. But for C-section, for cesarean section patients, please give your uterus time to heal. The recommended time is 2 years, 24 months. That will help your fallopian tube, your uterus,
the reproductive
everything to heal up properly, and for you to be able to carry a baby to term and probably this time have a natural birth. This has been Abatanya on City Star TV. Today we've learned a lot. Please, if you haven't subscribed, please hit the subscribe button as you're watching us. The notification bell is right there. Hit on that too so you don't miss out on any of our other episodes. Follow us on all our social media handles on Facebook, TikTok, Instagram, and Twitter. The name is City Star TV. I'm your host as always. Catch you same time next week, Wednesday or Friday, right here on City Star TV.